Hi, welcome to Public Health Part 2. This one's going to be a little bit shorter, okay? So I'm not going to go into great detail. I'm just going to cover some of the components, and as always, I want you to read your transcript that goes along with the PowerPoint Part 2 and review it on your own, do your discussion post and your assignments. So this is what we look at in Part 2. It's the different kinds of public health and the chronic diseases, and so a little bit of the achievements. So a communicable disease, which we mentioned in the previous slides, are any disease that is infectious or transmittable, and they give you some examples there. And how we control these in one way is always washing your hands, clean water, better sanitation, and antimicrobial activity, controlling infections such as TB and sexually transmitted diseases. The triumphs in public health, again, better antibiotics, overcoming polio, and overcoming smallpox. And that one I'm not going to go into for smallpox. And the current state. Now here's the issue. Now that some diseases have been eradicated, doesn't mean they're gone, okay? So vaccinations are very important, especially after eradication. They don't vaccinate for smallpox anymore because there hasn't been a need. But there are lab stockpiles, so the virus has been, other than that, the virus is gone. So is it a terrorism concern? And is it a biological weapon? It's hard to say, but it is always a threat, okay? The U.S. does have a stockpile of vaccine in case there ever is any bioterrorism with smallpox. Other triumphs is polio. Okay, it has been eliminated in industrialized countries, but it is still a risk in other countries. Public health, communicable diseases prevention activity, again, monitoring by your public health departments and your CDC organization to monitor it also. Food poisoning outbreaks. This is a good one. It's just an investigation, gives you an idea what public health does, but it's simplified and it's fictional. So public health gets a lab report of a disease-causing organism such as salmonella. So the public health epidemiologist investigates the reports. They come in for the salmonella. Samples are sent to the public health labs. Fieldwork determines that a certain number of ill patients ate at a company picnic. Questionnaires and stats analysis identify the culprit as a contamination of a dairy product at the picnic, which led to an investigation which revealed a sanitation issue. Then they do a recall. The dairy fixes the problem, now free of contamination, public health reviews, and that data becomes part of the CDC. And you see this repeated on the media all the time. Communicable disease topics, some that you may not know of: animal-related diseases, bioterrorism, childhood, drug-resistant infections, new and emerging infectious diseases, food-related, HIV, healthcare-related, insect-borne diseases, sexually transmitted, and water-related. Sampling, animal-related, example is rabies, which we've all heard of. Food-related would be, for example, E. coli outbreaks. Sexually transmitted diseases, gonorrhea. Big one now is HPV. Water-related, Cryptosporidius, watching for microorganisms in water. Animal-related, Staph aureus or MRSA. Healthcare-related, Staph aureus. And childhood diseases, such as chickenpox. HIV and AIDS sampling, monitoring of that, checking for outbreaks, and emerging infections such as Ebola, dengue infection, etc. One of the big concerns is terrorism and public health. This is a newer spectrum of study. It is a concern to the U.S. government and public. So, for example, my son actually went to Africa as part of a defense reduction strategy enforcement, and one of the things they did was they looked at the healthcare system in parts of Africa to see if they were following proper procedures in the event of a bioterrorism hazard or to prevent a biohazard. So if there is an incident, is that country prepared? What's their response plan, and how can we help them make a better response plan? You have emergency, You have emergency preparedness and response to your public health programs, to terrorism, in categories with ag terrorism. You take out the agriculture industry and you will create panic in the United States because agriculture is vital to our food source. Chemical terrorism, such as the use of anhydrous to create a chemical thing. Anthrax is disease, but using it as a transmission of that. And then also nuclear and radiation terrorism. So bioterrorism, you could get an overt attack that will create panic along with physical damage as well as encourage the spread of an agent. Covert is where you have maximum damage before a response can even be mounted. Labs could be debated for detection of covert attacks. Other kinds of bioterrorism, they're separated into 3 categories by the CDC. So the highest risk of bioterrorism is something that can be transmitted easily, could have a high death rate, could cause panic, require special preparedness. So that would be anthrax, smallpox, Ebola. Next category is moderately easy to spread, moderate illness rates, low death rates, but that would be ricin, typhus, food and waterborne pathogens. The third highest risk is emerging pathogens, which they're always monitoring for. Viruses do tend to change over time, so you have to watch for that. You're also emerging pathogens such as diseases that become more drug resistant. Public health preparedness and response, monitoring, and education are the 3 main activities. Best example I can think of that is our flu outbreaks, especially a few years ago when pandemic flu, H1N1, swine flu, all of those came out. Monitoring and education, but education on hand washing and how you can prevent the incidence of flu. Here's your lab response network that you can read over. Ag terrorism, they're used, often manufactured from raw materials, but agriculture is very important, so it's an easy target. And there have been a large number of introductions of agricultural pests and pathogens that could impact our agriculture industry. So, ag industry is regulated by the USDA through routine inspections. Chemical terrorism, different things that can happen would be the use of chemicals spread over a geographic area to cause illness and injury. Exposures, chemical exposures, biotoxins, poisons from plants, things that cause blistering, blood agents, poisons that affect the body when it's absorbed, choking and pulmonary agents, organic solvents, tear gas, toxic, things that, all kinds of things. Then you have nuclear or radiation terrorism, and that's a big concern for public health. And man-made radiation can come from different sources. Nuclear threats can come from many different areas, but always a threat. So if you look at bioterrorism, agriculture, all of these things, you can see where the Department of Public Health is important in monitoring things that are happening, but also looking at ways to prevent things that could happen. Then chronic diseases, the public health, they look at infectious diseases, but chronic diseases are just as deadly. So 7 of the 10 leading causes of death are chronic diseases: heart disease, cancer, stroke, and respiratory. So they'll look at chronic disease topics that are listed here. And prevention, 7 out of 10 deaths in the United States are caused by chronic disease. The only really treatment for chronic disease is behavior modification. So the risk behaviors are lack of physical activity, poor nutrition, use of tobacco, and excessive alcohol consumption. And you do wonder if that is going to change with time. So for example, the legalization of marijuana for some use, is that someday going to be ranked up there with tobacco use? Or could it be? The answer is not out on that, but 20 years from now, you might see a whole different story on prevention. Education, behavior mod is important. The only way it's going to change is education of the public. Here's the World Health Organization stepwise framework. This is made at policy implementation at national, subnational level and interventions. But it just shows you how worldwide we look to prevent and treat, and not prevent and treat, but how to intervene to prevent diseases. Environmental public health, things that we can do to protect the environment, like removing lead from gasoline many years ago, and removing lead from house paint is a triumph in that field. Means of contact environmental topics that they all address: air quality, radiation protection, solid waste management, water control, noise control, environmental control of recreational areas. Public health environmental programs are listed here. In one of your assignments for this week, I'm actually going to have you look out and look for public health notifications so that you can see some of the things out there. In chronic diseases and public health, there is overlap between chronic health and environmental. So for example, smoking, asthma, and air quality can all lead to respiratory diseases. Cancer can be linked to environmental hazards and exposure as well as chemical agents. There's also overlap between communicable diseases and environmental, such as bioterrorism and water quality. So it's not compartmentalized into a little box, but there's a lot of connecting points. So that's a summary for part 2. Enjoy your assignments for this week. And next week is week 15. It will be our last week before your week 16, which is your final activity. Go back to week 2 and start reviewing what the requirements are for the final activity. Go back into your course room to get information on how you want to answer those questions or what you feel would be the best response to get. Thank you.